Hello everyone. This is the 11th class for social psychological perspectives on health. In the last class, I talked about the sort of introduction to the chapter 8, and then I explained what kind of problems we have in society regarding depression. And one of the problem that we have regarding depression was a lack of progress in treatment of depression. So many people still suffer from depression, and so the majority of people who experience depression have depression relapse, meaning that they tend to have depression episodes again even after their original depression was treated. And I also explained about the biochemical model, and then I argue that well, so it is not the imbalance of serotonin, but a cause that induces the imbalance to be treated. So, antidepressant, the most commonly prescribed drug for depression, it helps to balance the serotonin within our brain, but it's not really the cause of depression, but imbalance uh, presents when individuals have depression, when individuals experience depression. So maybe antidepressant help feel better, but it doesn't treat the cause of depression. It just reduces the symptoms of depression. And in today's class, I'd like to introduce one of the studies showing how antidepressants are effective. So they basically they compared the effectiveness of antidepressant and the placebo, basically a sugar pill. And they found that in mild and moderately severe cases, there was really no differences in their effectiveness. This means that basically it's not really what are in the drug. It's not about the ingredients that are in drug, but instead taking medicine gave patients hope and expectation that the pills will treat the symptoms. So it was more like hope and expectation that they will become better by taking medicine. So it doesn't matter what kind of ingredients the pills that they are taking has in it. And but it doesn't really mean that antidepressants do not have any effect. Basically, antidepressants work better for people with more severe depression. And I think this graph kind of helps you to understand what's going on, what it looks like. Okay? So the uh, red line indicates how it is effective for uh, how antidepressant is effective to treat the depression symptoms. And blue line indicates how placebo is effective to treat depression. And as you can see, this line, the center line, above the center line or towards right from the center line, it indicates the severity of depression. So if it goes above 25, it means that patients have very severe symptoms of depression. Okay? So basically, if their score is like 10 or 12, their um, symptom is mild. And if their score is about 16 or 20, then that means their depression symptom is moderate. Okay. So as you can see, if their symptoms are either moderate or mild, the effectiveness of antidepressant, and the placebo are really indistinguishable. They don't look different. Okay. And but above 25, above the threshold or the criteria, then you better see the differences between antidepressant and placebo. Okay. So back to the, oops, give me a pause. Okay, so basically, in mild and moderate to severe cases, no differences in their effectiveness. And then, but antidepressants work better for people with more severe depression. Okay. So antidepressants work by dulling painful emotional experiences rather than by correcting dysfunctional brain chemistry. Okay. As I said, SSRI or antidepressant. I mean, as I said in the last class, SSRIs or antidepressants help people feel better or feel more relaxed and then safe. But it doesn't uh, cure the cause of imbalance. So if they stop taking the pill, the imbalance basically comes back. And then when the serotonin level is balanced, then they may feel better, but it will be very short-term period. Okay. So neurochemical phenomena may be better understood as correlates or manifestations of depression rather than as its primary cause. So if there is imbalance, maybe it means that patients are experiencing depression, but its neurochemical phenomena or imbalance of serotonin itself isn't really a cause of depression. And then to understand better the cause of depression, maybe you need to look for other areas that may influence people's feeling and symptoms, maybe. Okay. So if you are more interested in the biochemical approach and its critique, you can find some references here. It's DCOM. Okay. DCOM 2013. All right. So there is the biochemical model, and now we turn to the cognitive behavior model. This model is the most dominant approach in psychology, and then this is one of a few model or approaches that have shown the effectiveness. So there are different kinds of approaches, like there are different kinds of clinical approaches to treat some disorders, but not many of them are supported by scientific evidence, while the cognitive behavioral approach is one of the few examples that are supported by some scientific evidence. So let's see how it works. So if individuals have stressful early life events, maybe they were maltreated by their parents when they were child, and the events would contribute to develop maladaptive core beliefs, like one is unlovable or defective. And this kind of belief will contribute to thoughts like negative thinking about the self, the world, and the future. So basically, they think that they are not good, they're good enough, or they are bad in the future. It doesn't really uh, help them to become better. Or basically, the world, everyone around him or her dislikes them. So that's kind of negative thought they will have. And this kind of negative thoughts will lead to feelings like low mood, low energy, or hopelessness and guilt. So they may feel guilt for whatever they do or guilt for whatever they don't do. And that's because basically they believe that they are not good. You know, they have like overall general thought about negative thought about themselves. And this kind of feelings will further lead to some kind of behavior such as reduced activity, social withdrawal, and suicidality. Furthermore, these kinds of behavior will strengthen or reinforce negative thoughts about themselves and the world, and going on and on. Okay, so maybe with some concrete example, you may have better, even more understanding of this cognitive behavior model. So example of cognitive behavior model, let's say that you are working for a company and then you said hi to your boss, but you are ignored by boss. Okay, this is kind of event that you just had. And then what kind of thought will come to your mind? Maybe you say, my boss hates me, or I never get along with coworkers. You know, this kind of negative thoughts about others or negative thoughts about yourself. And this kind of thought will lead to some feelings like sadness, low mood, bad mood, or hopelessness, right? And then these feelings will make you uh, behave in certain ways. Like you might think, okay, I will never say hi again to my boss, or avoid eye contact with my boss or coworkers, or being absent from work without notice. Okay? And now imagine how how will boss will think about your behaviors. Like, okay, you never say hi to your boss. How does the boss would think about you? Maybe if you never say hi again to your boss may actually hate you. And then you think that, okay, I never get along with my coworkers, feeling sad, hopelessness. Okay, I will never say hi again to my coworkers. Your coworkers will hate you, this kind of things going on and going on. So this is basically how your thought change your feelings and how your feelings change your behaviors and how your behaviors reinforce your negative thoughts. This is how the cognitive behavior approach understands how depression or negative feelings and thoughts are developed. And according to some research, at least 60% of people are treated, at least 60% of people treated experience substantial benefits. At least 60% of people treated by CBT, cognitive behavior therapy, experience substantial benefits. And then improvements in symptoms and quality of life appear to precede rather than follow change in cognitions. So, cognitive behavioral approach think or argues that your thoughts determine your feelings, which lead to certain kinds of behavior. But evidence shows that Uh, so basically, because the CBT or approach argues that your thoughts change your feelings and determine your behavior. Cognitive behavior approach argues that if you change your cognitions, if you change your thoughts, then you would have different feelings, and that different feelings will help you to take more positive behaviors. Okay? This is basic argument of cognitive behavior approach, but the research shows that improvements in symptoms and quality of life appear to come before changing cognitions. So even if you cannot really change your cognitions, you can experience uh, improvement in symptoms and quality of life. And this is uh, because the most effective component of CBT treatment appears to be the behavioral activation component. And that is particularly effective when the activated behaviors promote social engagement. So basically, CBT, cognitive behavioral therapy, tries to change thoughts first so that their feelings will change and then their behavior will change. This is how cognitive behavior approach argues the effectiveness of cognitive behavior therapy. But even if they cannot change their thoughts and feelings, they could still try to change their behavior. And if they can change their behaviors, then they will feel better and they may change their thoughts and feelings. This is actually what the research is showing. So let's say you said hi to your boss and then but you are ignored. Okay, my boss hates me and I feel sad, so I will not gonna say hi again to my boss. But you go through the therapy and your therapist tells you that maybe you should say hi again to your boss. And you still believe that your boss hates you and then are feeling sad. But okay, my therapist tells me that I should say hi, so I don't care. Okay, my boss hates me. That's fine, but I still say hi to my boss. And you go to workplace and say hi to your boss. And surprisingly, your boss said hi, your boss, say hi to you. Then, well, maybe my boss doesn't really hate me. By uh, making different behavior, you may observe different consequences, and such consequences may change your behavior. I mean, change your cognition, change your thoughts. So even if changes in cognitions doesn't come first, if you change your behavior, then such changes in your behavior give you opportunities to change your cognitions. And this seems to be the mechanism that why CVT helps. Okay. So according to the research, maybe behavioral promotion comes first, and that will change your thoughts and then feelings. Okay. Furthermore, the primary contributing factor of cognitive behavior therapy is the therapeutic alliance, which is the quality relationship between therapist and patient, which is also called rapport. So in the previous lecture, I mentioned about successful therapist. So successful therapists usually show are seen to be honest, respectful, warm, interested in patient, and so on. So, and this kind of therapist, I mean, these kinds of attributes that successful therapists have are also something that people usually perceive in their in-group members. So by going through therapies, patients can develop alliance with a therapist, which could also be understood as developing membership or like a feeling of belonging to this, uh, therapy itself. So by developing sense of belonging and membership, patients could feel better. And that kind of feeling may also help them to change their behaviors. And by changing their behaviors, they can also change their cognitions, thoughts about the workplace, and that would help them to feel better. Okay, maybe this is something traditional or conventional psychology has missed, but more recent research is showing what's going on. Okay, so I will just stop here and then I will continue in the second video.